You all know the scary statistics. Childhood obesity is the #1 concern for parents in the United States today. It's higher than drug abuse, it's higher than smoking. And yet, until it hits you smack dab in the middle of your dining room table, you're probably not paying a lot of attention to it. That's what happened to me. I had a great career in private equity, 3 wonderful children, but I had a middle son who was gaining weight. He didn't want to go to PE, he was getting teased at school, and he avoided class on the day that they had to run the mile because he didn't want to see his time. We went to the pediatrician. No surprise, your son is overweight. Come back in 3 months, exercise more, eat less. We left. I had a frustrated son, and I was a really scared mom. I tried to make changes in the household, but to be honest with you, I really just ended up making things worse. If I wanted to lose weight, there were actually a lot of really good options available to me. I could use Weight Watchers, MyFitnessPal, but none of these are safe for children. They all involve calorie counting, and kids are not supposed to calorie count. $60 billion a year is spent on weight loss for kids and for adults, and none of it is safe for kids. There were no tools available for me. So I found the Stanford Pediatric Obesity Center. At Stanford, 85% of the kids lose weight, 70% of the parents lose weight. This is a safe system, but it's $3,500 and has weekday afternoon sessions, so completely not available for working parents. But I found Thea Runyon, and Thea had helped hundreds of kids over 12 years and their families lose weight, and we teamed up, we licensed the Stanford program, and we created a mobile, scalable version of their approach. So today, we're here to present Kurbo. Let's switch to the demo. Kurbo is a mobile platform to enable children to eat healthier and to lose weight. First, choose your avatar. Research shows that if kids pick their avatar, they're much more likely to pay attention to the advice that it gives them. Then choose why you're doing the program. If it's to make your parents happy, that's actually just fine. The core of the Kurbo system is the food tracker. Rather than tracking calories, we have you track your red, yellow, and green foods, and the foods are classified by their nutritious value. So things like sugar and carbohydrates are classified as red. We give you goals for how many reds you can eat each day and each week, and we reduce those numbers very slowly so kids don't have to make big changes, but as they slowly make changes in their diet, they end up losing weight. We have challenges of the day, challenges of the week. Can you have a red-free day? Can you exercise more this day? We've been working on progress screens with therapists where we incorporate a lot of therapy into our program to reinforce certain learnings that we're giving the kids. And then we have virtual feedback. The avatar I talked about earlier, it gives you reminders and messages based on the food that you're eating. So we see what you're eating, and then we can send you very personalized suggestions on how the changes that you can make a big difference in your child's life. Then lastly, once a week, a coach calls. Either they call on the telephone, they can call using Skype, they can text, however your kid is most comfortable, and gives them very specific feedback on how to budget for a birthday party and how to eat healthier, taking the role of the food police away from the parents and putting it into our system, reducing the emotional tension in the household. Okay, let's go away from the demo. The really great thing about Kurbo is that it works. We have over 200 people on our system right now, and the kids are losing weight. Parents tell us that their entire families are eating healthier and that they're fighting a lot less about food. Kids tell us that they are really proud of the changes that they're making, and they're asking us if they can please get their friends and their siblings also onto the program. We have a very efficient business model. We're giving a free food tracker so that we can attract as many kids as we can and help as many kids as we can in our program. We charge $35 a month for text messaging, primarily for teenagers who seem to prefer it, and we charge $85 a month for live coaching, which can be on the telephone or on Skype, however the family most prefers. Kurbo is scalable. In addition to PR and social media, We are talking to health insurers like Humana and United Healthcare. We're talking to hospital systems like Kaiser and Sutter Health, who are currently testing our product. And we're also talking to educational institutions that are interested in using Kurbo in their PE classrooms and the nutrition classrooms. So we have a lot of interesting ways to scale our product. We put the Kurbo on our Facebook only in February to attract beta users. And we had thousands of people from all over the world contact us to please be part of our beta. Parents were literally begging us to get higher on the list, and kids started texting us saying that they wanted it and how could we put their friends on the program. My son Jared, he lost 15 pounds. He runs the mile 2.5 minutes faster, and he is a much happier kid. His mom found a new sense of purpose. At Kurbo, our job is to help millions of kids worldwide eat healthier, feel great, and lose weight. Thank you.
Judges, you guys want to jump in?
Sure, I'll jump in. So it's a fascinating idea and obviously a huge problem. So you're talking about mobile application, and we know that through mobile apps, gamification obviously brings back engagement into the application. And then two, we all know that weight loss is obviously helpful when you have other people kind of keeping you accountable and helping you lose weight. So how do you think about the social features within the app from kid to kid, both help them stay engaged and also spread it with their friends?
So we have a lot of social features that we are building. We have a big challenge, which is that we have this available to kids who are over 13 and under 13. And the protections for kids who are under 13 are very high. So we have spent an enormous amount of time making this a safe system and a protective system. So we have groups. You can invite people to join your group, but the groups are anonymous, and there's no talking. It's all done using emoticons so that there's no teasing, and we make sure that you get the emotional support you need. But we were actually surprised how many teenagers texted us saying, we want our friends here. So we are developing those tools so they can bring their friends in the program, and they can set up a group with their friends anonymously or with a family group or kids in their community.
Thanks.
I think it's also fantastic that you're tackling such an important issue. I was wondering about the coaching, because it sounds like that's your business model. How do you identify the coaches? Are they affiliated with the Stanford program? And also on the business model side, how does Stanford benefit from your product?
So we have a license with Stanford for their program. They have a 1.5% royalty that they get. And the coaches we have been recruiting, we're looking for teachers, we're looking for people who are trained in talking to children. We are not looking for nutritionists. We want people who are really good at giving positive feedback and developing emotional relationships with the kids. And we have more people wanting to be coaches than you could imagine, because everyone likes this idea and they want to be helpful to other kids. So we have a huge wait list of people who want to be our coaches, and we're getting ready to start scaling them up.
Throughout your beta testing, what is a challenge that you identified, something that you guys don't do well yet, and what are you going to do to improve that if you win?
Okay, the parents are the challenge. We thought that the phone calls were going to be with the kids, and instead, the parents want to get on those phone calls. And what we have learned is that it is very much a family-based program, and we need to give the coaching to the kids and to the parents. So we've hired a parent coach. We are trying to get all those parents to text us and to email us instead of taking up their entire child's phone call. And we're trying to evolve the business model so that we can definitely figure out how to help the parents with their problems as well as the kids.
Yeah, I mean, on that, just to dovetail on that, if that's all right. I mean, yeah, you said you had thousands of people come to the Facebook page and want to sign up, and I can imagine parents doing that the world over. But I can't, like, if you're as a parent, I can't, tell your kid to go lose weight. You're fat. Like, that's a weird dynamic. Okay. So how do you think about from the mindset of the child,
so
and get them to initiate the incentive at the first place?
So I love that question. This is a really important issue for us marketing-wise. If I choose on my marketing message and I say, eat healthier, or help your kids eat healthier, no one clicks on our ads. If I say, help your child lose weight, we get an enormous number of clicks. When they get to the website, it says, eat healthier. And so what we've learned is that the parents don't want to tell their kids that the child needs to lose weight. They want to tell their child they need to eat healthier. And so at the back of the website, we talk about losing weight, and at the front of the website, we talk about eating healthy. But I can tell you that if we advertise that, no one comes. And so that's been a really interesting lesson for us in terms of how we market to make the website appealable to the kids and to the parents. But it's the parents who are paying, right? And so we have to be marketing to them.
What kind of tools do you give the parents to help them convince the kids that this is a good idea? Because I might not be the normal kid, but when I was a teenager, anything that my parent asked me, I would do the opposite.
So the whole point here, right, is that we're taking that food police job away from the parents. It is a really fun program. I mean, I'd love to give it to you to play with. There are games, there are challenges, you get rewards. If you're a child who really needs a lot of rewards, we actually have a system where the parent can put in a big reward. So for example, you can say, oh, if you do this for 3 months, you can keep that iPad that I just got you to do this program. Or, if you do this for 3 months, I will take you on a special day, Mom and Dad Day. And then we track that along the way. And if you do what you need to do, meaning you track your food for that period of time, then we remind you that you're going to get that reward. So for a kid who's recalcitrant, it's a good solution.
So if I'm the kid and I just lie to the app, what safeguards do you have against that?
You want to answer that one? People have been lying to Thea for years about that.
If you're lying about the food that you're eating.
lying about your
Yeah, just say like, I'm not eating the candy, I'm just eating healthy stuff.
So from a coach perspective, you always assume that the child is telling the truth. And so you have to come from a place of truth. And a fellow colleague in my office said, Thea, when you talk to a kid, it sounds like you come around in a circle. And I do. I start talking to the kid about their choices. I start talking to them, are you being accurate about what you're tracking? Let's make sure we've got the portion sizes right. So it's about how the coach interacts with the child. But in the end, a child can lie, but then they won't be successful.
If a child says they're eating no red foods and they're gaining weight, maybe we'll say, well, maybe you want to pay a little bit more attention this week.
Maybe they're just not very good at lying.
Right. It's very data-driven.
And that's okay. I mean, we know what they're eating, right? So we can tell if they're tracking or not. And we're working with therapists, so if they don't track their foods for 1 day, they get a little message. If they haven't tracked it for 2 days, they get a different message. And we are working with some really smart people to design those messages to bring them back in a way that doesn't feel judgmental and celebrates their coming back.
Cool. Well, we're out of time, unfortunately, but thank you guys very much. That was Kurbo Health.